My name is Sylvia Advent. I'm a coordinator for volunteers. I work at the QE2 Hospital in Grand Prairie and also look after the sites for Grand Cache, Beaver Lodge, and Hythe. And I've done this for just a little over 10 years. I do love working with the volunteers, making sure that they are in a program that they feel they are contributing in a meaningful way. I do individual interviews with all new applicants for their volunteering. We provide them with a packet that they need in that application process. I also do an orientation for the new volunteers so that even though they may look at our provincial handbook, which is very helpful, we talk about how does that work at the QE2 Hospital. And then we do a more site-specific orientation as to their program. Patient care is really our prime focus. I find our volunteers can come alongside and sit with patients, whereas professional staff may need to be more task-oriented. So we have volunteers who do visits. They assist our recreation therapy staff as well with their programming, whether that's our patients in the hospital or residents in long-term care facilities. There are some great volunteer coordination programs and literature that is available for training. Some great opportunities for a person considering this role would be to work with people in a volunteer fashion, probably have some volunteer experience themselves, and then be willing to just be very flexible with your job. I have been a volunteer even prior to my working here, and so I've just had a little bit better than 20 years of volunteering. Still maintain my role as a visitation volunteer. I think the best part of this job for me is to interact with so many people who are willing to give of their time. We can make an impact to people, to encourage them, to give them a quality of life that's very meaningful and touching, and it's just encouraged me many times over to let other people know that they do make a difference in other people's lives.